Some interesting Hodgkin's data at this meeting, not a huge amount, but some quite interesting stuff. There was a report from Italian group looking at a new second-line combination. So they've used ifosfamide, gemcitabine, vinorabine combination with some real great success. And after some efficacy data of bendamustine in the relapsed setting in Hodgkin's disease, they looked at bendamustine, gemcitabine and vinorabine together, a BeGEV regimen. And they used this for patients with relapsed or refractory Hodgkin's lymphoma. I think that there was about 60 patients recruited into the study, and they had an overall response rate of greater than 80% and a complete response rate of in the mid to high 70s. So very well tolerated, a great toxicity profile, and had no detrimental ability to mobilize peripheral blood progenitor cells. So presenting a highly effective and safe second-line therapy for patients with Hodgkin's lymphoma. And the key thing about treating Hodgkin's disease at relapse is achieving a complete response. So you want a regimen that's going to have a high complete response rate, because that's your best marker of success following high-dose chemotherapy consolidation. So some really interesting early data, and certainly a regimen that's worth following up. Interestingly, the German Hodgkin's lymphoma group presented some data on managing elderly Hodgkin's lymphoma. And this is a continued problem, how we manage elderly patients with Hodgkin's, because the toxicity of the chemotherapies that we have are greater in the elderly population than in the younger patient population that we treat. And we frequently find that if we are compromising on the chemotherapy that we deliver, then our outcomes in the elderly population are less good and not as good as we'd like them to be. So the German study looked at the AVD combination, so ABVD without the bleomycin, and replaced that with lenalidomide, which has shown some activity in Hodgkin's lymphoma, and of course targets the microenvironment, which is really critical to the propagation of Hodgkin's. Actually, what they found, unfortunately, was that the combination was still very toxic, and really their higher dosing cohorts, there was some significant toxicities, and felt that probably this is not the right regimen to take forward in the elderly population, but I think an important investigation.